Hi all, just wanted to do a quick video, a bit of an update, just to firstly apologise for being omitted in action at the moment. I just can't face being on the Facebook page at the moment with, seeing everyone who would be the same date as me for my first miscarriage, which is probably about 32 weeks, something like that, I've been now, and also people that had just found out they were pregnant around the time that I did just now, so it's just a bit too much salt in the wound at the moment, so I've kind of avoided that page. I'd like to say that I'm alright, but I'm not really. I did bleed, and it was for about 6 days, the longest one ever, 7 days maybe, so I know that definitely was different to a normal period. So even different to my first cycle that was abandoned with all the medication that I had then to build up the line and stuff. So it wasn't that. I know, obviously, I had a pregnancy because I had those tests and everything. But a lot of people have asked, maybe it could have been the medication that gave you the positive, but no, because I was on a frozen cycle this time, so there was no trigger shot, there was nothing, so it was a HCG. They did tell me that my HCG, when they did the beta on the Friday of my test day, that it was 7, and that is anything over 5 is a pregnancy, but being 2 weeks after transfer wasn't high enough, and had obviously come down from what it was to get to 7, but I still technically had the hormone in my system, but it was just decreasing. So, yes, it was definitely a pregnancy, and no, it wasn't the drugs. I now have been told that my funding because I've been funded for 2 fresh cycles on the NHS here in the UK, and I've been told that the funding runs out in September the 1st, so that's 2 months. They've also told me that usually with a fresh cycle, any frozen cycle would be honoured because it comes from the same fresh cycle. Obviously, you get the eggs from that round and they get stored, so it's seen as one go. Just like this time, I've had 2 a fresh and a frozen. It could have been classed as 2 attempts, but they haven't, because it's a frozen that went along with the fresh. But they've told me that I have to have had the frozen to do the fresh and the frozen by September, or I have to pay for it. And I've said, well, no, it should, if God forbid the next fresh cycle doesn't work and I do have to use my frozen embryos, they should be honoured as part of the funding, but apparently they're not. Apparently I'd have to pay if it didn't work, so that's an issue in itself, because it would mean that Zav and I would have to keep our embryos on ice and start saving, and it could take ages. Could take ages to get the money together, and they only store them for free for 2 years, so that's another annoyance. So I'm quite desperate, feeling desperate and low at the moment, because I'm feeling like my opportunities are running out. So obviously this last cycle I found out that I had a clotting gene, and they gave me the relevant medication. They gave me heparin injections, which I had every day from the day of transfer, and aspirin that I've been on since my ERPC back in January for my first miscarriage. I've had that every day, baby aspirin of 75 milligrams. So really you can kind of almost rule out the clotting thing, because it wouldn't have been that. So there's obviously other reasons why I had a miscarriage. It could have just been one of those things. It could have been a chromosome thing. But I'm to the point now where I don't want to risk going through another fresh cycle and a miscarriage, and that's my last attempt, and I haven't tried to get any testing before. So, with that being said, I've been to my GP, and I've said that my original diagnosis about my tubes, I want to know exactly what was said, because I was never really given the feedback. They just told me, you've got blocked tubes, you need IVF. I want to know how blocked they are, whether there's a chance you can have a an operation to unblock them, or, just I want someone to have to look at me with a fresh eye and do more tests. So the doctor has urgently put me forward for the gynecology department in Surrey. It's a hospital. It's not specialist, so I don't know what tests or whatever, but they might want to just check my uterus, the womb, everything again, just to make sure that there isn't anything else underlying that they've missed, which would be good. But obviously the doctor's going to do it urgently, because he, obviously with the chance that my funding will run out soon. I've also asked him if he could forward me to the miscarriage specialist in London, who deal with miscarriages, recurrent miscarriages, but the waiting list is really long, he said, and obviously their criteria is quite tight. You have to have had 3 miscarriages for them to even see you, but I don't know whether that means I would be seen differently, because I'm not just someone that's trying to conceive. I've got underlying issues anyway, so it's a little bit of a different circumstance. So maybe they would see me because I've had 2, because especially with all the funding and everything that's going on, so they might do that. But yeah, he said for me to wait for this hospital appointment to come back first, but I'm debating whether to kind of admit myself to that hospital, just to send them a letter and see what they say. But I don't know if they do things under the NHS there, which is obviously the funding that I've got. I don't know whether you'd have to pay, but again, it would be an issue of money, being able to have these tests. There's also a clinic locally. It's an IVF clinic, but it's not an NHS funded one. I don't think. I need to find out. I don't think it is. It was never given to me as an option. And they do NK killer cells, which is like a raised amount of cells that, like immunity, they fight off things like cancer, colds. They're in your body for a reason, to fight off diseases and things. But some people can have an elevated amount of these cells, which can fight off can sort of attack the embryo and things. So a lot of people get given steroids to avoid it. So I've spoken to my clinic, and they don't do this testing at all. They don't believe in it. There's not enough studies and blah, 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 blah. And they're probably the only one that I've seen locally that don't do it. And also I want to have genetic testing, like chromosomal testing on myself and my partner, to see whether we've got any issues between us, because there's also a chance that you can get your embryos tested PDG, post-genetic diagnosis, which is the other way around, on your embryos before they implant them, so they will know whether they're chromosomally fine or not, or any issues before they implant them, which is obviously a cause of miscarriage as well. So yeah, my options are to either, I've got an appointment with my clinic to see whether they will put me forward for any more tests, what sort of tests that they do put you forward for. Genetic, maybe. They've already told me that they don't test for the NK cells, but they've told me that they might possibly put me on steroids because I've had this second miscarriage, but I'm wondering why they would do that anyway. Might just be a precaution thing. And if that's the case, if that's the treatment that you would have got from the NK killer cells, then, and they're willing to give that to me before I've even been tested, then fine. At this point, I'll just do anything to prevent another miscarriage, My last chance of IVF, I want it to work. And each time I've got pregnant, I must be fertile, because each time it's implanted, but they just not made it for whatever reason. If it's not the clotting, if it's not my uterus, if it's not, there's obviously a reason there, and I want to know what it is now. So, if they don't do NK testing, and if my clinic are saying no, I might have to refer my funding somewhere else. Basically, I'm just stressing out because I've only got 2 months to do all this, and with waiting for blood tests to come back, it could take 6 weeks, and I'm now waiting for my period, and then from that period, it'll be 21 days until I start stims again. So I need all of this back before that time. So I'm absolutely stressed beyond my wits with this whole situation, and I'm just hoping that they'll get me seen and everything soon. But it is a money issue at the end of the day, because if we had all the money in the world to do these attempts, I wouldn't be stressing, because I'd be like, if it doesn't work, I'll do it again, But they're like 6 some of these cycles are £6,000 or something, and that, or it works out 6,000, something like that, once you've had the procedure, which is just 2,000 something, and then all the drugs and all the scans, and then, you know, if anything happens, you need to be given this and extra medication. It just builds up and builds up and builds up. And imagine if we got a loan for a follow-up cycle, then it doesn't work, then you're still paying for it, and it's not as if we can get another loan out, and it's just, I don't know what we're going to do. And obviously the older I get, I've just turned 32, the older I get, the less chance it works. So, just, I don't know, but that's it. I just feel, at the moment, like there's absolutely no hope. I just feel like I'm not going to be a mum. You know, obviously I'm not saying that if I do another fresh cycle that I do get a big fat positive that I'm going to have another miscarriage. But if I do, then I don't want to have missed the chance to have been tested. It's going to be too late. They might say, yes, we can do miscarriage testings on the NHS. You know, they might say that they could do that because I've had 3. But by then, I won't be able to do another IVF attempt anyway. So, and I can't conceive naturally. So what choice do I have? I don't have any choices. So, yep, it's now or never. So, yeah. Anyway, that's my update. And hope you're all well. I miss you guys so much. Like, literally just being able to, like, put statuses up when I'm feeling crap and whatever, but I just don't want to be on, I don't want to get notifications all the time and just be reminded. I'm trying to kind of shut myself off from it as much as I can. So, yeah, that's it really. But I hope you guys are well. If you've got any kind of advice or anything, would be most appreciated. Or, you know, just let me know what you think I should do, considering I have to have started my cycle by September the 1st. So, and I'm probably like, I don't know what cycle day I'd be. My official test day was the Friday the 1st. The Saturday, Sunday, I think I came on my period around the Sunday. So that's the 3rd. No, it was probably more the 4th actually. The 4th. No, it was the 3rd. Sorry. Yeah, probably about the 3rd. So the 3rd would have been cycle day 1. So I don't know what we are now. The 12th. So that's where I am. I'm going to be getting my period soon, whatever. And then from then I'll be supposed to be starting my cycle. I could wait another period, I guess. I don't know what the dates would work out and whether it would mean that I haven't started in time for this funding. But yeah, we'll see. If you've got any advice, please let me know because I'm desperate. Thanks for watching. Bye.